All right, hello again. This is Chad Everett Broshears. I'm the host of Growing Up in the Wilds of Suburbia and the author of the Human Manual, up and coming book in the near future. So today's guest is Dr. Dani McVety. She is a veterinarian. She's a doctor of veterinary medicine. She's created the company called Lap of Love. It's a in-home euthanasia and end-of-life care, as well as a hospice care company, so in-home hospice as well. So Dani will obviously correct me a little bit on that, just so we get a really succinct version of what she does. Apologize about the disconnect there. I knew I was going to be tested.
You did very well, Chad. You did very well. Very well.
I got a B plus.
Yeah, we'll go with B plus. That's fine. It's better than I did a lot of times in college.
Yeah, better than you did in college a lot of times.
A lot of times, not always.
Then watch out for the average students out of school and the rest of the world better watch out. All right.
It's not how much you know, right? It's how much you care. That's it.
Exactly right, and how willing you are to learn.
Yep.
Right?
Yeah.
So today's subject is conscious medicine. And Dr. Dani has graciously introduced this to me, and I found it extremely fascinating. And I really loved the exploration of medicine with this. Most people's presuppositions on medicine is that the doctor and this is it. And you go in and it's kind of a sterile experience, and medicine is really like this almost stale thing. And with Dr. Dani's experience and what she's implemented has really taken a human element into what medicine is like, both in, we're speaking about the veterinarian world, but this, in my opinion, also greatly impacts the actual, human medicine versions as well. So Dani, if you would, go ahead and take it away. Bring everyone up to speed on that awesome conversation you've given with me, or that you've had with me.
Thank you, Chad. Thank you, Chad. Yeah. No, you did a great job explaining what I do, and I kind of got to that from an evolution of what I like and what I don't like. And I found that what I really, really enjoy in medicine is helping the people. And even in veterinary medicine, that's the case, because the animals don't come in by themselves. They come in attached to people. So if I can help the people that love the animals and maintain the relationship for as long as possible, that's really where Lap of Love was born. That's where I felt that I was providing the biggest gift, and then that's just what I was drawn to. So we started Lap of Love Veterinary Hospice. My business partner and I, Mary, she's also a veterinarian, obviously, and she got to be a veterinarian from the traumatic death of one of her pets. So she left the job that she was in, making very good money, more than she would ever make as a veterinarian, and decided to do that. So just following her passion. And I think that's one of the things that has provided me this kind of life, which is literally just following what works and following what I like, because what we like ends up usually being what we're good at also. A lot of times, maybe I should say that in the other way. What we're good at a lot of times ends up being what we like.
Right.
So, yeah, and it's funny because in medical school, we're taught to treat the disease. Medical school in 4 years of graduate college, there's no way they can possibly teach you every single nuance of medicine. That's why it's called practice, because we're constantly practicing, constantly learning. So in medicine, we're taught to treat the disease. We're not always taught to treat the patient. And that's not medical school's fault. It's just the way it is, because we have to learn everything down to the cellular level, which is awesome. And when you talk to any doctor that's been out for any length of time, particularly orthopedic surgeons, and I've heard orthopedic surgeons say this. And the reason why I say orthopedic surgery is because they're dealing a lot with people that are otherwise healthy. So systematically, they're generally healthy, but there's just a ligament, a tendon, a meniscus, a part of the body that isn't well. But an orthopedic surgeon will tell you that they can determine whether or not this surgery is going to be of success, literally based on how the person feels about the procedure. So are they happy to be having this? Are they excited about the change that they're going to have? Are they optimistic? And then that is going to determine to a greater extent whether or not those surgeries are even going to be of success, right? Mm-hmm. And we all know this, that we could be completely tired and I don't want to study and I'm burnt out and everything. But then all of a sudden, I'm looking at all my books. I'm like, I don't want to study. I'm so tired. I have to go to sleep. Right? Then we go to sleep, right? But if a friend were to say, hey, Dani, let's go ride horses. Boom, immediately I'm awake. But that potential was already there in the first place, right? Like the whole potential was there. And I think it's even more applicable in veterinary medicine because our animals don't have that emotional interpretation to what they're going through. There is none. They live in the moment, like always right in the moment. And it's so interesting to me to talk to people that say, you know, I would never amputate my dog's limb. You know, obviously we deal a lot with cancer and with bone cancer, particularly in large dogs. It would be, it can get them quite a much longer length of time if we amputate a limb. It's not always the case, but a lot of times it's the case. And the interesting thing is that how many people don't want to do that? Mm. They don't want to do that. I would never do that to him. I couldn't do that. I'm like, but they wake up and they're fine. They're happy. They're running around. You know, they don't have an emotional interpretation of like to their limb, which is actually kind of funny. So we're also completely fine, you know, with like castrating or neutering animals. I'm sorry for that. But we'll tell like some clients that don't want to do it, like, listen, don't have an emotional attachment to the testicles. I know like people do, but humans, like, you shouldn't do that. It is actually very good for them. So it's just another way of putting that some people kind of get. They're like, oh yeah, you're right. We do that all the time, but don't worry about taking off the limb. Don't worry about having to take out an eye. They're not worried about the perception that other dogs have about them. And then if you look at it, other dogs don't change their perception of them also, right? So it's not only from the inside out within the animal community, it's also from the outside in. I don't know, it's just this very super, super interesting thing, you know, that I get to see.
Yeah. You know what, actually, that's just a fascinating aspect. And it's challenging for me not to want to grab it and run with it, right? Like the why people behave this way. Why is it that humans have these tribal, you know, mentalities of being inferior? And then in the animal kingdom, we're still a part of, but with them, like with other animals, predominantly, it's just a thing that happened, but they can live still fully satisfied, or at least perceptionally fully satisfied. But with us, we make it such a negative thing, right? Or an outcast thing. You don't have symmetry. You don't have this or you don't have that, and now you're less of a person. I love that. And I, like I shared with you earlier, I didn't actually know. I never even thought about how an animal would experience a loss of a limb compared to, you know, like what, you know, a human would experience with the loss of a limb, you know, like say a dog or a cat, to make it more specific, or any other, you know, more pet world, right? I never considered it. And then you brought it to mind, and like, yeah, why wouldn't they? Like, why would they have a problem with it? You know, because they don't live in the world of superficial values like a lot of people do, right? And I think that's an awesome insight you brought.
Yeah, and they do. They have some hierarchy, you know. But the point is, I mean, you have a few dogs, Chad, so you know who's at the top and who's in the middle and who's kind of more at the bottom. But the point is, they're okay with it. Right. That's kind of the point, is that they are relatively okay when there's an imbalance of power, and then maybe they might jockey for position, you know, as one pet gets a little bit older. There is that. I mean, even the animal kingdom, you wouldn't have lions fighting lions. You wouldn't have, you know, monkeys fighting each other over territories. Yeah, of course that happens. But the point is, they're okay with it.
Right.
You know, like they die, a housemate dies. I'm privy and witness to this all the time. Housemate, the other housemates are okay with it. That doesn't mean that they don't grieve. It doesn't mean that they don't show changes. It doesn't mean that they don't know. They know, but they know in a canine way. They know in a feline way. And they're accepting of it. And it's funny when you talk to behaviorists, veterinary behaviorists, they'll say, you know, one of the most common things that the questions that they get is, you know, so-and-so dog is beta, and the alpha dog is always attacking the beta dog, and he never fights back. How can we stop doing it? Like, listen, they're okay with it. They got it. So when you walk in the door and when you greet the beta dog first, just because as a human, we're like, I'm going to give you more attention, you're the underdog. When we do that, we are imbalancing their power. Right. And that's actually when the alpha dog will attack them later, you know, depending on the situation, to pack the beta dog later, because us, you know, the human alpha, who is a different type of alpha, we're not a canine alpha, we're a human alpha. Right. Then the human alpha, you know, encourage a structure that they are not okay with. So the veterinary behaviorists will say, you come in, you greet the alpha dog first, honor their structure that they have set up, honor their structure, and then greet the beta dog, and then everyone ends up getting along better. You know, isn't that interesting?
Yeah, absolutely. You know, and something, just an observation, and I may be off on this because it's not my area of expertise, but I have noticed that that's depending on the circumstance kind of changes the hierarchy. You know, like Sugar Bear is one of the smaller of our dogs, right? So we have 4, right? Because Ashley absolutely is infatuated with the love that she has for our dogs. So we have been very generous with our living space by adopting, you know, having 4 dogs. Sugar Bear is mine. I've had her for over 9 years, or she's my, you know, life companion at this point, right? Little Sugar Bear, she's about 30 pounds. She looks like the tramp from Lady and the Tramp. We call her the hall monitor. Now, she's not the biggest dog to enforce her will on others as far as like just being this clumbering giant, right? Or able to viciously attack, but she loves to nip, and, you know, she really wants that alpha position. But she's like the hall monitor. She learns extremely well, but, you know, Taylor has kicked her little butt multiple times, right? And Beano he's not the smartest of all of them, but he's also very eager, and he favors Ashley greatly, and he's willing to learn as long as we put in that effort to teach him. But just, I see the hierarchies changing. And then, of course, having the youngest now, which is Aurora, which is wonderfully and thankful that we've adopted her from Dr. Dani. She's adopting characteristics of all 3 of the dogs. Like, she is attentive like Taylor, she's playful like Beano, and she can be bitchy like Sugar Bear, right? But I've just seen that depending on the circumstances, they shift the position of who's actually kind of like, I got this, right? Yeah. I've just noticed that. Now, I may be wrong on the position of hierarchy and the power struggles that may be there, but I see a pack working as a unison, kind of like an organic system that is just adapting to the stimulus. Yeah. But still, I could definitely see that if we come in and greet in a disorderly fashion, that their behaviors are different.
Right. Right. Yeah, it is. Just like you said, it's constantly changing also. Yeah. And there may be a period of time when it's peaceful and that's good, right? And then there might be a little bit of disarray. But that's how medicine is also. Yeah. It's the same thing. We can have these periods of time when the physiology works well, and then there was periods of time of dis-ease. Right. You know, things have gotten thrown out of proportion for whatever reason. So then how can you bring it back in? How can you focus all the attention, that the dogs have, to let's bring back the order, bring back the consistency, bring it back. And it doesn't always mean that means an external factor has to come in. It doesn't always mean that antibiotic is the case, that this is the case. And even it's funny, I have human children also, human children too, furry children as well. But with my human children, the funny thing is I went through 3 pediatricians before I found a pediatrician that I connected with and that connected with my kids. So I can connect with a pediatrician, no problem, but I also want one that's going to connect with my kids. Yeah. And why that was important to me is because I didn't want a pediatrician treating me. I wanted one that's going to treat my kids. If I'm freaking out, right, because I'm a human mom also, so if I'm freaking out because I have an emotional interpretation of everything that goes on, then I don't want someone giving my kids antibiotics just because they're treating me, because I need something. Can they explain to me that 80% of ear infections are viral? Can they explain to me that 80% of the upper respiratory stuff that we get is viral? Can they explain to me that it's normal for a kid to get sick? The dis-ease is normal because that dis-ease causes more structure and more function, more antibodies and more things to occur in the body so that the body is more healthy on the other side. Yeah. That's kind of the way that I started looking at medicine, particularly when I had kids. It actually changed the way I practiced medicine because I realized what my emotional interpretation was of what was going on, and also what my children's emotional interpretation of what was going on. Because completely different. They can fall down and skin their knee and cry, and guess what? The next moment, they're fine. Right. They're fine. And there's no wrapped up in this, what's going to happen and this and that, and I'm going to have a scar in my leg. They don't have that yet. We teach them to have that. Yeah. How do we teach them to have that? Like, they're fine. It's every little part of dis-ease is for a reason. Every little part. But I agree. Cause and effect, the outcome of it and all of that, it's all with purpose. There's a lot of value to it. Something that did come to mind and we mentioned earlier when we were on the phone kind of setting up is
talking about the modern education system, because, you know, a lot of people are going to listen to this, and, you know, like people that are going through veterinarian school or veterinary school, they don't know what it's like just yet. Even if they've interned, they still don't know what it's like to be the veterinarian, right?
Yeah.
So what just came to mind as far as an analogy is universities and colleges are usually kind of like the IKEA of education. Like, it depends on how you put it together once you have your product, right? So you have your education, there's your diploma, here it is, right? Now you got to put it together. And what you're describing to me, or what I'm hearing, is that this is how you put your furniture together, right? Your education, you know, how you put it into action and making a living education. And a lot of people think that once they get their graduate's degree or whatever it is, that they're done, right? They don't have to worry about this, or what they learned in school is like, I mentioned that, you know, school is anything that's written in textbooks or novelties, because they're outdated the moment they're written, because now they're old technology and it needs to continue to advance. So once it hits the streets, if you will, it's evolved into this next thing. So the IKEA education that you got, which is awesome, and it doesn't by any means mean a value system, it's just how you put it together, is, to me, it's an extremely romantic position of education, because you have what can be considered a sterile education, which is what you learn in the, you know, the walls that the universities offer. Then you have to make it work in life, which is where we make it, you know, identifiable with our character. And yours is, children brought this new example into your life and how to be with other people, how to start deciphering how to navigate life, how to find the most effective practitioners to work with your family, right? And then therefore, from your observations, how to relay that back to your patients, which is awesome.
Yeah, I love that example. That is such a good example. You're right. And you can't go to medical school or veterinary school or and really any education and think, I'm honestly, even down to the high school or elementary school level, you can't go to school thinking geometry is what I'm going to use for the rest of my life. No. Geometry is teaching you how to think in a geometrical way. You know, biology is teaching you how to think in a biological way. English literature is teaching you how to think in a creative way. But it's not, you're not taking tools, you know, you are learning how to make them in the future. And even if some kids will, you know, I talk to veterinary students, they're like, yeah, but I'm never going to use this histology. I'm like, no, you may not use it every single day, but you're going to know where to find it. And education teaches you how to think, not necessarily what to think. Veterinary school has more what than any other school, obviously. And it was funny. I don't really think that I valued my education to the extent that I should have until I was in veterinary school. When I was in veterinary school, I finally had the like, oh my goodness, I'm sorry. When I was in veterinary school, I finally realized, I'm like, this is stuff that I'm going to use always, every single day, you know, but I didn't ever have that in undergrad or high school and everything. But yeah, and also veterinarians, but people who have gone through higher education, that doesn't mean they're necessarily smarter than anybody else. I mean, honestly, it really doesn't mean that you're smarter. To an extent, you were able to take the pain for a long time. Right? Like the pain of studying, the pain of debt, the pain of, you know, of opportunity costs by not going out of school. But so it's interesting, and those type of people are a lot of times the type of people that will sit behind a book and look up the answers and try to figure it out. And if I don't understand something, I'm gonna dive into the material and try to get it. So it is, and it's probably because why doctors are so different from each other. And you may think that doctors are the same, you know, regardless of what specialty, but doctors are just people. We're just people. And we have our own emotional interpretation of what's going on. We have our own emotional interpretation of our families that we work with, of the diseases, of the treatment options. And it is. And if people say, I don't like my veterinarian, I don't want to go back, or my doctor, or whatever, I say, go find a new one.
Right.
You have to find someone that you connect with, because if you can't connect on the conscious level, the medicine isn't going to be there. You're just going to be doing and not kind of being healthy. Yeah. I had someone say to me one time, they're like, you know what? I think that I should put my doctor on retainer and that I should pay him every month I'm healthy. And then the months that I'm not healthy, you know, I shouldn't have to pay him because they should be invested in health. I mean, it's an extremist, you know, view, but it really you have to think about it. Okay, what are we invested in?
Right.
Are we invested in sickness, or are we invested in health and well-being and longevity? You know, it's a different way of thinking. And that's why I love what I do. You know, my practice is totally different.
Yeah, and that's something that I identified, very early on, and that's it's something I actually cherish about your characteristics and your personality and your practice, is that you do view it almost from another viewpoint. It still aligns with other viewpoints in the sense that care is care, and we want to be able to provide care, but it's the way that you see it is, to me, there's wisdom present because you can see particular patterns and you know how to actually address the challenge before the challenge shows up. Where if you go by traditional means, you fall into the pitfalls and you continuously, even though you're intelligent enough to endure veterinarian school, right? You still have pitfalls you'll fall into if you lack wisdom. Right? Because wisdom is just functional knowledge. It's how to predict patterns and how it actually can, the future may look, not as an absolute way look, but it's usually pretty accurate. And I see your practice being a little bit more, structurally built with wisdom in place. So I've actually have enjoyed that. And it's one of the reasons why you and I are, in these conversations, is so I can bring that awareness to more people, so they can also see what they, commonly find in me, telling me I'm super intelligent or something. I don't ever align with that, by the way. I'm like, not me.
No,
not me. I'm interested.
Right.
I'm simply interested. I'm not Mensa material. I'd probably be kicked out if I were, just because I like to dispel a lot of nonsensical hierarchies. But with all of that being said, and that's a divergence that, I'm not wanting to take that rabbit trail at the moment, but I do want to just acknowledge that where you are. And now for, the audience and is also to expand on what conscious medicine is I'd like to, if you wouldn't mind, just give kind of like a definition to what that is, and then we'll build on it a little bit more so people can actually understand how to identify whether or not their veterinarian or even their doctor is practicing this particular viewpoint, and how to be the change they want to see, so that a patient can generate a doctor to see this without having to directly tell them, because you see from a human's perspective, as people come into you for your services, you see how they behave, and you pick up specific characteristics that you find become more effective in your practice by modeling their behavior or trying to encourage your patients to model behavior from another patient, right?
Right.
So,
right.
would you mind giving a kind of doesn't have to be a medical definition necessarily, but just something a bit more definitive so that people can wrap their minds around it? Because you and I get it, but I'd like to be able to make it, tangible to the point where people are like, oh yeah, that's conscious medicine. Booyah, I know who did that too. I know who coined that. Right?
And I know, and I don't know if that's coined at all. And you and I were talking a little bit a few weeks ago, and I'm like, yeah, how about conscious medicine? And I just came up with it, and so maybe someone has it for me. I don't know, but I mean, I would really, if you want to say it succinctly, it would be really treating the patient being invested in wellness instead of treating the disease invested in curing.
Right.
Right. So, and I literally just kind of came up with that on the whim here as we're talking, but. How do you say something that's very abstract in a very short way? And that's probably how I would describe it, is that you have to be treating the patient for the outcome of wellness, right, not treating the disease for the outcome of baseline, basically zero, curing. Because then you're just invested in curing, and you're not invested in kind of even better than curing, which is wellness.
Yeah. What I also can see as an outcome of this is the identifying markers. Like as a disease, a lot of times people like to identify they are their disease.
Yes.
And what you're talking about is actually you are your wellness. Yes. You may be out of balance, but you are your wellness. You are not your disease. Because when you identify with a disease, you justify why it's okay to have it and why you should be personally attached to having it, right? Because it's just the psyche of it, right? Yeah. The psychology of disease. And you're not,
also, I would want to qualify this, not just the disease in the physical form, but the disease in a mental form also. It could be the depression, right?
Yeah.
But yeah.
Right, especially in people, because as we mentioned earlier, you don't have to have the loss of an eye or a limb to feel like you're a social leper. All you have to do is have something that pushes the rules or your own personal boundaries as your definition for your particular tribe or your group or your whatever construct you have socially, whether that's your family or your friends or your charity organizations or whatever it is, whatever could make you a leper in that, right? The outcast, and it's usually self-created, self-derived outcast that really isn't even a truth. It's just a truth to the person.
Mhm.
So I see with this is you're giving an opportunity to completely shift the context of medicine and the sense of how someone perceives receiving it, which therefore also shifts the way that the doctor perceives giving it, as well as they perceive being it,
Yeah.
rather than I'm an insurance agent that needs to spend 15 minutes with you. In the medical world, human medicine, and then in the veterinarian world, fortunately, insurance hasn't infiltrated it heavily yet.
Right. Right.
So you can still be care. So anyway, a tangent, but yet at the same time, I feel that I felt that it was really a wonderful justification because it's inspiring, right?
That's neat. Yeah. Yeah,
Yeah,
it is. And it starts in hospice care, and I think that that's kind of where it's all formulated for me because I have no other choice. In hospice care, I have no other choice other than the patient and keeping the quality of life, and then focusing the owner's view to that. And I think that it really can go much further than that. And I know that it can go into the senior stage, and then because we're in the geriatric stage in hospice care, but it can go to the senior stage. It can go to the adult stage. It can even go to the young adult child phase. So it can go everywhere as long as we're invested in the right things.
right.
And invested from the inside out. I mean, doctors for generations have talked about this. Eastern medicine is a lot of time based on that philosophy of being completely in line with the chi, completely in line with everything working and flowing together. We're all connected.
Absolutely.
The cardiologist is not disconnected from, the hematologist, disconnected from the gastrointestinal. It's all connected. And human medicine really has, and a human doctor would tell this too, they've segregated themselves so much that the cardiologist is only dealing with the heart now and not dealing with anything else. And then the other, specialist is only dealing with their stuff and not dealing with it from a holistic viewpoint.
Yeah.
So, yeah.
Well, something to expand on that as well is, have you ever heard the statement, a jack of all trades, master of none?
Yeah.
Okay. I disagree wholeheartedly with that. And why I disagree is because I'm a master of adaptation. So I'm a jack of all trades, a master of adaptation, right? So if something were to occur in my life, I have a skill set that I can do something else with relative ease. I can shift into another ability with relative ease and master those areas, because I bring the skill sets necessary to master in other areas into this other, which can be a new area for me. But because of the way that I learn, because I learn holistically, I learn, through, the entirety of education that I am capable of. So master of adaptation. And I would love to be able to see that, because an example of some of the hardships that come when you excel and master one thing, right? You become an expert at one thing, is just consider that there's only so many spaces for CEOs in this country.
Mm-hmm.
Right? Well, what happened during 2008 whenever CEOs were losing their jobs? You had people that were used to making millions of dollars or, a very large amount of money with a very significant skill set, but then they couldn't find jobs anywhere. Right? And then there was no fallback. And this is also a benefit, in my opinion, towards medicine of all types, is because you can see things through the holistic system. And now you actually can identify, I'm no longer a cardiologist. I'm actually a gastrointestinal education, as well. And, urology and, endocrinology. And, it's like you open up the parameters. You're not practicing medicine in that necessarily, but you are expanding your knowledge so you can see other pitfalls that lie outside of your expertise.
Right. And that has to do with connecting to the patient.
Absolutely. Yeah.
And not just connecting to the heart organ or that organ, but connecting to the patient, what the patient wants the outcome to be. And I talked to I was speaking at UC Davis this past weekend, and an actual radiation oncologist came up to me. So he's an MD, and he goes, because I think he actually came up to me before a euthanasia talk that I give of all things, and he was there with his daughter who wanted to be a veterinarian. But he came up to me and he goes, I had a patient that was going through dialysis, abdominal dialysis, which is not always a very fun thing for them to go through. But he was going through dialysis, I guess, at the very beginning of his medical career. And he said, how's it going? And the guy said, fine, I'm doing this. I think it was like every day that the guy was coming in or something. And this doctor finally said to me, he said, this is what you want to do for the rest of your life? Like basically told him, you will have to do this for the rest of your life. He had some type of terminal cancer. The point is, nobody told him that he would have to do that. Nobody told him that he would have to do this dialysis for the rest of his life, every single day of his life. And he was probably going to only have 6 months or so to go. But once he was told, he had a different perspective of it, and he elected to not do it anymore, and he elected to have that kind of quality of life that he determined. Nobody can determine that quality of life.
Right.
Nobody can determine quality of life for your own self. And for a person to decide that for themselves, what their quality of life is, that means that we get to live from a place of being accountable for every action that we do, like from the beginning to the end, including how we practice ourselves or practice on ourselves when we're in this disease.
Right.
So I don't know, really hit me. I was like, yeah, you're right. It's the same thing in veterinary medicine too. I have people thank me all the time for telling them that their pet isn't going to get better. Like, nobody ever told you that? No, they didn't they didn't tell me like you just told me.
Right.
And in a way to give you permission to not go through all these expensive, diagnostics and then more tests and then more treatments and this and that, and give you permission to decide whether or not that's a good thing or a bad thing for you.
Right. And it's a beautiful thing to give somebody permission.
Yeah.
Right. It's like, it's the same thing. If you look at like some of the consequences or some of the actions that lead up to the point where we may have one of those life-threatening moments, is it didn't happen in a vacuum. And if you believe that medicine's there to cure you of anything and everything, it takes responsibility and accountability away from the individual. And it's just another Tylenol that they'll have to take for a headache, right? Where they'll live under the belief that cancer is a chemotherapy deficiency.
Right.
So it gives people this, like, it's a hall pass to doom, right? It's a hall pass to ill health. But from your perspective is like, and for what I'm hearing, and correct me if I'm wrong, but if we started to implement this kind of medical practice to all avenues of medicine, it'll start at a young age. Every child that goes to see their pediatrician, right, will actually be educated in such a way that your health is your responsibility. I'm just there to put the Band-Aid on whenever something happens.
Yes.
Right?
Yes. And I mean, there's a way of living where you are a victim of every circumstance that happens to you, right? Or you're accountable for everything that happens to you. And it's a choice, right? I mean, there are people that can live in the mindset that they're accountable for who their parents were.
Absolutely.
Right? Like that you picked. I mean, and again, it's neither here nor there. It's a choice. It's a way of living. So one of my favorite authors, Dr. Wayne Dyer. He's one of my favorite authors, right?
Yes, we've discussed him briefly.
Yes, we have. So he tells a story about when I was children, and I think his little girl was, I think, about 8 years old at that point. Maybe a little bit younger. I'm not sure. I'm not sure. But he tells a story where she had some bumps, and I have kids, like they can get little warts and they can just get little bumps, and it's part of their immunity growing. So she had bumps on her skin, and the dermatologist said, this is completely normal, and they're going to go away. But if you talk to the bumps, they might go away sooner, right? So he tells the story where he was they're on vacation, and she has a blanket over her head. One time, like he goes, "Hey, kiddo, are you ready to go to bed?" She goes, "Be quiet, Daddy. I'm talking to my bumps." And no less than like weeks or months, a very short amount of time, they were gone. But she didn't have that ego developed yet. So when Wayne Dyer tells this story, and when I heard him tell the story, he was telling the story with Deepak Chopra, who is, he's an MD, he's a neuroscientist, he's amazing also. So they were bantering back and forth about the fact that she didn't have an ego involved in that conversation to herself yet. There was no ego involved yet. So she was able to have that conscious, attachment to her body and what that meant, and for her to literally talk them to go away. I did the same thing with my son. I did the same thing. He had a particular type of wart that takes a little bit longer to go away. And I told him, like, no, you just have to talk to them. And he got it.
Right.
6.5. I'm sorry. He got it. Yep. It was really amazing.
It really is that conscious medicine value. Yeah. Right. And if you go into the world of psychology, it's the attachment values that we put on specific things where we can make that statement, what you resist persists. Yeah. And even if it's a skin blemish, if you develop a fundamental aspect or a viewpoint of yourself that's identifying being ill, for whatever that may be, even if it's just a superficial skin blemish, the identifying marker now becomes a functional way of seeing life. Right? And you're talking about offsetting that. Like, to me, this is one of the best medicines that we can practice. And this is an individual's medicine, right? It's actually giving power of responsibility and accountability back to your health, and by way of a very rational perspective. You can fully put this into a medical practice. It's not a esoteric position at all. To me, I can see it very tangible. It's teachable, it's recreatable very easily. So
it shifts it from the outside into the inside out. Yeah. It's simple. It's hard, right? But it's simple also. Like, it's just looking at it from that perspective. And animals teach me that every day.
Right.
They don't have an emotional interpretation of what an antibiotic is.
Yeah.
What any medicine is. They don't want to be in the hospital because it's a place of stress for them.
Mm-hmm.
So it's good and bad parts about that is that my comforting them only goes so far, where it might go further with a human, but it's still from the outside in. They live everything from the inside out. I mean, literally, I learned so much about disease, about medicine, about how to live life just from watching an animal go through life. It's incredible, really. It really is.
Yeah. This is like I love food for thought. Yeah. Most people that know me know that I don't listen to music very often. If ever I listen to music, it's put on to me by, maybe I'm at a restaurant or something. I spend my time listening to lectures and videos and like finding something that gives me a satisfaction of development. And this idea in itself, right? It just like of the awareness that a dog really isn't attached to their limbs, right? If they wake up, they're wagging their tail because they're so in the moment about life, that they get to experience the joy that life can offer without worrying about how they'll be outcast because of the loss of their limbs, or, how their life is now changed and the worry that comes with change, right? The unknown, and now new limitations they're unaware of. And this gives so much food for thought, right? Even in the quiet moments. And I've shared in other videos that I don't have a lot of those conversations that go on in my head anymore, where we have where you get this talking conscience about how things should have gone, or you start talking to yourself about something. And I found that I don't have much of that. But I do have is there's the unfolding of a new thought, a new idea, or a new portion of functional knowledge, how to explore its limitations to my own limitation, right? And this gives that value to me. Conscious medicine, it's a beautiful perspective. It's one that I feel it's just going to take a matter of time and continuous conversation, and it will explode into something that you and I had not foreseen when you mentioned it, right? Because I do feel that this is a very strong shift in towards becoming more responsible for your own well-being. Right. And it simply starts with a very simple position. It may be hard for some people, but hard just means that there's resistance to change. Right? And the way that you relay it is one that I would say comes across with less harshness, because your demeanor offers your position of kind translation of thought. So I can see how you'd be really effective if only we could get that implemented on early stages of medical development, right? Hell, I would even love to see it put into elementary schools.
Oh, can you imagine?
That'd be awesome.
Can you imagine kids growing up thinking like, my goodness, what I feed myself is important to my health. What I think is important to my health. What you think is important to your health. That's the whole point. Conscious medicine, right? Right. That's like the whole, I can't imagine like a child growing up with that. I can, because that's how I'm, treating my own children. Right. And teaching them like, this is what you think expands. My son and my daughter both said to me last night, they're like, yeah, mommy, what you think is what you create. I'm like, oh my gosh, it's amazing. I like for them to grow up knowing that, not thinking it, it's thinking and knowing, but knowing that they are responsible. And yes, if something happens, maybe you know it's going to happen or not happen. What disease, either inside of yourself, outside of yourself, it's just like watching the 4 dogs and their pack stuff, right? Yeah. You could be calm for a moment, and then look at that. They heard us talking about it. See, yeah. And then there can be a moment of jockeying for position, and it's normal. Expecting that. knowing that that's going to happen. It's completely normal. And then when we accept it as normal, it's like all of a sudden it's not a problem anymore.
Right. Yeah. Or, that challenge that seems to have no solution or limited solutions. That's Taylor, by the way. She says hello.
That they know we're talking about them.
Yeah. Actually, I think she's talking to somebody out on the street.
Right.
That may not share her same language.
Right.
Her love language.
Right.
Right.
Yeah.
So if anything that we could create out of this, would you say that there's almost like a litmus test for someone to qualify whether they see life through disease factions, if you will, or if they are capable of kind of qualifying this? I would hope that they have, but I'd like to try to speak at as many different levels as we can to try to implement every idea as effectively as possible. Would you say that there's any way of qualifying? I know that this is a new terminology, if you will, with this, growing definition, right? Which is awesome, right? To kind of be pioneering your own position, which is really cool, right? Especially as the more functional it seems, the more, rational. Why wouldn't this catch fire,
Right.
Is there something that you could use as far as off the top of your head, kind of like a litmus test for this?
Gosh, I don't know. I'd actually have to think about that. I mean, it would really be almost whether or not someone identifies with it or not. If you can say conscious medicine, whether or not they're like, huh? Or, oh yeah, and whether they know what it means, but your reaction to something is always going to kind of tell you what you're in resistance to or not, I think.
Yeah.
But yeah, I'd have to think about that. That might be a next talk that we have to have.
Right. Yeah, and I'm going to propose another one at the end in hopes that you and I actually have the opportunity to cover it, because I'm very passionate about the one I'll propose. As we mentioned before, also, my position on optimism and pessimism and that kind of fun stuff too, right? This one's not that, though. I'm passionate about that subject as well. But perhaps also we can kind of throw something out there to where how people do identify with their disease is they're practicing medicine from the disease position. Once they're diagnosed, like for me, I was diagnosed with UC. For people that are unfamiliar with that, it's ulcerative colitis. For people that are unfamiliar with that, it's bleeding colon ulcers, right? And it's very uncomfortable and it's life-changing for a lot of people. And I was one of those individuals that found life-changing effects. So if you identify, and I struggled in the beginning when I was first diagnosed. And then I found that I didn't identify with the disease. I happened to be out of balance to the condition point where they actually said, this is what's so. But I really didn't use it as an excuse for behavior. So for me, it would be the identifying as a behavior or defense. Like say if somebody has MS and they decide they're going to make a couple of leniencies for themselves, their IBS kicks in, but not IBS irritable bowel syndrome. IBS is in integrity baseline syndrome, where I'll make up my own integrity lines and I'll function inside of that. Or you didn't do this, so I don't have to do this. That's also a description of the IBS, integrity baseline syndrome. So if we could use on the other side, are you identifying with a disease? If so, one of the factors of correcting that would be implementing the conscious medicine. Right, which is now you're no longer your disease. You're a person that happens to be out of balance. And how do we restore balance? By self-education, curiosity about our condition, and how to overcome by establishing balance. Right. So if that could be something as an expanded position on, kind of developing our own tests to find out if we fall into that conscious medicine or if we're in more traditional medicine, if you will, disease-based diagnosis.
And it's a little bit out of my, I guess, specialty, if you will, because I deal with veterinary medicine.
Mm-hmm.
And so human medicine, when I talk to humans about a condition, it's so funny to have to also deal with their own interpretation of that condition.
Yeah.
Right, because there's the medical condition that exists without interpretation, and then there's the doctor's interpretation of it, and then there's the patient's interpretation of it. So I don't have to deal with the patient interpretation of it in veterinary medicine, but I do have to deal with the client's interpretation of it.
Right.
Which sometimes can change the way we treat, but most of the time it doesn't. Whereas a patient's interpretation does change how you have to treat. I would imagine. Again, I'm not an MD. I'm not a human medical doctor.
Right.
But it's interesting to hear you talk about your own condition, and then how that affects and how that manifests really in your life, and how much you allow it to affect your life or not affect your life. Whereas in veterinary medicine, we don't have that. So, gosh, it's hard for me to just go off on that, because I don't deal with that so much. So it's gosh, where would I take that?
Yeah. Well, how about where we take it from here is, I know there's borders, barriers, and definitions to titles, right? So you being a doctor of veterinary medicine doesn't mean you don't have space to speak in human medicine. You have your perception and you have your viewpoints, which every one of us do, and all of them have a degree of value, right? So I would say that with this, it's not infringing on a license value as much as it is like you're a mother. You know what it's like, as it's the same for you in a sense that when you take your pet to see another veterinarian, as it is to bring your children to see their doctors, you may project your fear into the situation for treatment. Just like, as we mentioned before the recording, is some people may actually see, and I know that I would have to struggle with the question or that position for a moment if I knew that one of our animals had to have one of their, something amputated, right? A limb or something amputated, that I would have to I would do the empathy thing, which is what we all do. That's, it's a wonderful thing that we have emotionally driven towards other people's well-being. I would actually implement that empathy value onto my dog. If, say, like Sugar Bear or one of the other ones had to have something amputated, that I would have that quick struggle with, okay, do we actually just go ahead and put them down because they're lacking a limb? But that's coming from my own position. But that's based from how I would perceive the world would experience me, as well as the limitations that I would then therefore have due to that kind of consequence, right? That kind of circumstance.
Right.
So,
and it's funny you bring up empathy, because empathy is, of course, I feel what you feel, right? Sympathy is I feel for you, but I feel what you feel. And it's funny when we talk about empathizing with our pets, because we are anthropomorphizing, not necessarily empathizing, right? Because you can't feel what they feel. People will say they feel guilt, they feel shame. I don't know that I buy into that completely. I don't know that they feel guilt the same way we feel guilt.
Right.
They feel shame the same way we feel shame. Right. It's not the same. Same thing with grief and everything. It's not exactly the same. So yeah. That's very funny. When I start a hospice consultation, whenever I start that conversation of what we're going to do, the vast majority of the time at the beginning is all about me listening to what the family's interpretation of what they've gone through already and what they want. So I need to hear what they feel they've gone through. So like if and I'm completely talking off the cuff here with regards to human medicine, but I can imagine being a human medical doctor and spending all the first half of the time that I have with the family listening to them and what they want and what they think is going on, what they think is going to happen, what they would want to happen. Because if I can, number one, let them get that out. So just get that out. All of a sudden, whatever I say at the end is going to be more powerful because they know that I have listened to them. So when I've listened to them, anything that I say back they feel that they've already connected with me. Because when we talk about ourselves, we release oxytocin. It's the feel-good drug. It's the cuddle drug, hormone rather. And when you talk about yourself and get that out, particularly to a doctor who you value their opinion coming back at you, now all of a sudden what you say going back is very weighted. It's very important. And knowing what they want, I can then guide them through what I can do as a doctor. You want your 18-year-old dog, I think I said this before, with congestive heart failure to have a natural death. Well, let's talk about what natural is. Let's talk about, what going to sleep and not waking back up is, and then what I can do. So basically realigning what they want with what I can do in medicine. Yeah. So I would imagine a lot of those, it's the same in human medicine. It's the same thing. What do they want and what can I do about it? The same thing. Yeah.
And it just may be the shifting of where the person listens from. Yeah. The difference between, veterinarian and human medicine is where they listen from and then how it affects their own mortality.
Yes.
You know, because we can see our own mortality in our pets, but it's easier to see in other humans, especially family members.
Right.
Which brings you to, oh man, I don't have all the time in the world left. Now I need to start really being critical about my decisions. But whenever it comes to our animals, sometimes we may project that onto them. But I would say that it's kind of a little bit of a different experience for some people. I know for me, it brings back my own mortality because I absolutely am attached to my little furlings. Yeah, so we're nearing the end, and this has been an awesome conversation, by the way, and it's not just my own hubris that projects that. It's, I really enjoy food for thought, and in our exchanges, I take it that you also find that same privilege when you find a thought that really, kind of takes hold.
Yeah.
So I'd love to see how this expands a bit more and how we can explore this position in the future. But what I would like to discuss in a future broadcast would be, you may or may not recall, or I may not have mentioned to you that I started writing a book called In Defense of the Ego. And what the ego is, and it's, how to mature it, and then going through the different stages of brain development, reptilian, mammalian, and then the human brain, and how that relates to the ego's position and all the rest of this. So I'd love to go into the exploration of that particular viewpoint in a future conversation.
Sure.
Exploring conversation, right? And exploring viewpoints, rather than necessarily like the concept of debating and all of that, but just exploration, tandem exploration of thought. So I'd love to, extend that opportunity, and then, obviously, extend the same opportunity to anybody who's watching this to potentially stay aware that that video may come out soon. Because I get turned on greatly about that conversation, right? Like you mentioned something about ego, and I'm like, ooh, I love this conversation.
Yeah, absolutely.
And I find that that's also completely connected to conscious medicine. It's actually completely connected to all of our existence, but it's how we interpret what these things are. So I know that I'm kind of turning the tide in my state, in my position, against Eastern philosophy of the ego and a lot of even Western conceptualization of the ego. But I'm okay with that.
Okay, well, there you go. I love it all. I don't debate, but I love having discussions.
Yes, absolutely. So tandem exploration of thought.
Love it.
So yeah, I encourage that, and if that's something you want to explore, then we'll set a date and time, and we'll go into that. But as far as this goes, thank you so much for your time with this, and it will stick with me for a while. As I continue kind of like to mentally occupy, so making this a mental occupation. So that it explores and expands and continues like an air mattress. It's not the shape at the end as it was in the beginning, so it just fills out the entire parameters to our own limitations, right? And the exploration after we hit our limitations is where the real fruit lies, right? So I love this viewpoint. I hope that it catches on. I would love to see that we explore further, and that you create a few more, borders, barriers, and definitions to it, so that it can be implemented. Because I know that you speak on a large level, and you speak in a lot of opportunities, and people really value what you have to say. And the way that you've translated this in this mere 1 hour has been extremely powerful for me, being a witness to it and a participant to a degree. And I'd love to hear how this may actually come out in some of your more future talks.
Well, thank you. Thanks for that opportunity. Yeah, I hadn't even really thought about it until you probed me for another topic, and I love it. I realize how much I've been doing it already.
Right.
Yeah.
And that's the whole intention. We want to be able to recreate it.
Yeah.
Right. What do we have? Right. We have what we can offer, and you're offering quite a great deal to the academic world, and even to beyond the academic world, to the layperson as well. And I'll fall into that category. Being a pet owner, call myself a layperson, because I'm definitely a consumer of your education and how you can implement and produce a commodity for me. So I love what you're up to, and I hope to see that we can expand on that further in future videos as well. So with that, Dr. Dani, is there anything that you'd like to offer in closing?
Gosh, not particularly. I'm so thankful for the conversation. I love it. It's yeah, I guess my mind going too. So I appreciate you even just entertaining me in the conversation. It's very fun.
Well, it's like-minded and reciprocated. So thank you for your time with that as well. And we'll continue to talk a little bit about the ego conversation. And I'd love to be able to set a date on the viewpoints, optimism, pessimism, and all that as well.
Yes.
If you'd entertain that.
Yes.
It'll be a little less formal.
Okay.
So yeah. But other than that, though, thank you for your time on this. This is Dr. Dani McVety, the doctor of veterinary medicine and the founder and co-founder of Lap of Love. So if anyone's interested in finding out more about Lap of Love, I highly encourage it. It's one of the greatest end-of-life care systems that I've ever seen for our wonderful pets. So I would definitely advise people to take a look at it, it's Lap of Love, www.lapoflove.com.
Yep, .com. Yep.
So thank you very much.
Very good. Thank you, Chad. Appreciate it. Thanks. Okay.
All right. Until next time, again, this is Chad Everett Broshears. I am the host of Growing Up in the Wilds of Suburbia, and this has been a conversation with Dr. Dani McVety. Thank you, guys.
Yeah. Bye.